Could I first of all say, Taoiseach, that last week the crisis and accident emergency departments across the country reached intolerable and unacceptable levels. Over 600 people on trolleys. And we're not talking statistics here, we're talking real people. Because every person, we're talking about a child, a parent, a grandparent. Immense distress caused, and the fundamental question: was their health compromised? Was their safety compromised as a result of the unacceptable and chaotic situation in our A&E departments? And great tribute must be paid to frontline staff. But fundamentally, Taoiseach, the point is that the crisis should never have escalated to the level that it did. And notwithstanding the promises of James Riley when he said, never again, he said, will there be 5, 6, 9 patients on trolleys on a single day while this government is in office. Never again, he said. Now, look, it took us a while, but not too long, to understand that the man didn't have much credibility when it came to making promises and commitments. But people actually believed you, Taoiseach. And they believed you when you said on that big billboard, I'll end the scandal of patients on trolleys. And if we're looking for the details of how you do it, we were to go to www.fianna.ie to look at the plans. But what happened here, Taoiseach, was as far back as July, the Minister was alerted by his officials in the department when he was told about 650 delayed discharges in the summer, 6 months before Christmas. In October, you were warned in here in the House, Taoiseach, about the Fair Deal scheme. And Taoiseach, despite all the rhetoric and the language, how can you possibly say that you could deal with this when you have funded 1,400 less beds under Fair Deal for 2015 than you did in 2013? So year after year, you took out beds that were available for discharge and expected the system to cope.
Thank you.
And it couldn't possibly cope. And you knew that, Taoiseach. You knew that. And you were warned, and the Minister was warned. And he sets up an A&E forum late December. Late December. And he said he knew this was coming. And we put in plans, he said, to try and deal with it. And when he came back from holidays, he said, I don't know why the plans didn't work. God help Joe Citizen, who contacts www.fianna.ie to try and find out. If the Minister himself doesn't know how the plan didn't work. What I want to ask you, Taoiseach, is this. Do you believe that the accident and emergency departments were safe for patients at a level of overcrowding that was experienced in recent weeks and continues to be experienced? And will you reverse the cuts to the Fair Deal scheme and provide adequate financial resources to make sure that we do not have waiting times for access and eligibility to Fair Deal itself? And in relation to the nursing home beds that are available to be commissioned, will you commit to providing the financial resources that all those beds will be commissioned and opened and that the frontline staff will be recruited to provide for same?
Taoiseach.
Thanks very much. Just checking on some of your record today yourself in this matter. When this happened before, you said that it wasn't a crisis. You said it wasn't your fault. And I think, if I recall correctly, I remember you putting an end to waiting lists in 2 years, but that's in the past. The answer to your question is that the accident and emergency departments were not as safe as they ought to be, with the numbers that were in the units and, as a consequence, in the corridors. Minister for Health set up the Emergency Department Task Force in December 2014. There was another meeting of it today. Obviously, they're working on a serious plan here to regulate this in a way that will not have these surges that occur every so often becoming full-blown crisis. You're aware that the government provided 25 million in the last budget on top of an additional additional 3 million in late 2014 to address the delayed discharges in the hospitals. That's been targeted at hospital and community services, which can demonstrate initiatives, to move patients from acute or transitional care into long-term care or to return home with appropriate supports. The HSE have advised the Minister that additional beds to cope with what are called surge pressures are now open. that all non-urgent elective procedures have been cancelled, but urgent and cancer surgeries will continue. The role of consultant doctors in terms of ensuring additional ward rounds and patient transfers has been emphasised by the Minister, particularly so because of the change of rota of junior doctors, and the use of additional capacity in non-acute hospitals, particularly to provide rehabilitation care, is being expedited, like in St Luke's and Kappa and Navan. And ambulance bypass cover arrangements will be put into place in exceptional circumstances and with the prior agreement of the group CEO. So the plans are working with the numbers below the high recorded on the 6th of January, not satisfactory by any means, at 298, I understand this morning. So this is an area now that is part of a priority focus by the Minister, together with the task force, to see can this be dealt with. Some hospitals, as you know, are more difficult than others. The Minister's just been answering a topical issue on that. There is the private members' motion later on this evening, where there'll be a greater opportunity to discuss these events. In respect of the nursing homes, obviously there's a growing need for places in nursing homes with an ageing population, but the current physical location of many of them is not as close as you'd like them to be for the transfer of patients coming from heavily populated areas. That's an issue that has to be addressed for the future.
Thank you.
But I think, Deputy Martin, the fact that the Emergency Department Task Force has been set up has had a number of meetings, and meeting again today is indicative of the priority being attached to it by the Minister for Health and the HSE.
Thank you. Deputy Martin.
Taoiseach, I think your initial response was a bit Schleiveen, if you don't mind me saying so. We're not as safe as they ought to be. What does that mean? Sorry? What does it actually mean? I asked you a simple question. Were they safe from a clinical perspective? Were they safe from the patient's perspective? From their health? What saying they were as safe as they ought, they were not as safe as they ought to be, is a meaningless phrase to me. And it doesn't deal with the core question. And the reason I asked you a question is that numerous spokespeople were asked on public television from the HSE. They were asked simple questions: were they safe? And if you go back through the transcripts of those interviews, everybody fudged the answer. Yeah. Just as you have fudged the answer now. And it's a core question, Taoiseach. And the other point, Taoiseach, is this. This was coming for quite a long time. And the new minister was told in July about this. But go further back. Go back to the budget 12 months ago and the fraudulent figures that we were presented with.
Thank you.
And you closed beds during the year, Taoiseach. You closed beds. 48 in St Luke's and Kilkenny General Hospital closed. South Tipperary, 14 beds. St Joseph Ness, 75. There's a whole list of them here, of all the beds that were closed. And then you took out 1,400 beds less out of Fair Deal than was provided for 2 years ago. I mean, in the name of God, how did you think the system was going to cope with this? You tried to get away with it.
Sorry, Deputy, would you put your question?
And you've been trying to get away with health now for the last 3 to 4 years. And you've neglected it as a priority in government. And that's fundamentally why all records were broken last week in relation to accident and emergency. Because there was no consistent and persistent application to the issues that do occur and will continue to occur. You tried to get away with it, Taoiseach.
Thank you.
By cutting it short. And you got caught. But that's not why I'm worried about you getting caught. I'm worried about the more fundamental question of can you guarantee patient safety in the overcrowded scenarios that occurred in accident and emergency departments across the country last week, this week, and in the coming month. Can you guarantee it? And do you accept that they were not safe for the patients concerned? They couldn't be.
Taoiseach.
People in armchairs with conditions, and elderly people in armchairs with very serious conditions, and cross-infection being a potential risk.
If I recall, you're the former minister who accepted no responsibility for any of this. You denied there was a crisis when billions were sloshing around and being wasted by a prolific government. The answer I gave you is not meaningless with respect, Deputy Martin. If you have overcrowded emergency departments and patients on trolleys in hospital corridors, the situation is not as it should be. And it's already, we've admitted on many occasions, it's not right and proper to have patients on trolleys, particularly those who have had to wait over 9 hours on a trolley. And that is not as safe as it ought to be. I think that that's clear, and far from being meaningless, it's a realistic. It's a realistic appraisal of the scale of challenge that we face here. It's not all about money, it is about management as much as anything else. And clearly, in a situation where you can never foretell accurately the numbers who may wish to avail of emergency departments, it's not a black and white situation to say it's safe at 4 o'clock and it's not safe at 5 o'clock. It's not right and proper to have trolleys occupied by patients for over 9 hours, and it's in that area in particular that the Minister is working very hard to regulate this properly.
Thank you.